Welcome to the deep dive. Today we're really zeroing in on a vital topic in healthcare, continuous improvement, or CI.
That's right.
You, our listener, sent over a great collection of articles, resources, and our goal today, well, it's pretty clear. Pull out the key insights on how healthcare organizations can actually build systems for, ongoing progress.
Absolutely. We're aiming to get past just sort of talking about wanting better healthcare and dig into the actual methods, the strategies for creating what gets called a continuous improvement ecosystem.
And why should this matter to you listening? Maybe you're prepping for a healthcare strategy meeting, maybe trying to get your head around how hospitals are tackling quality improvement.
Or maybe you're just interested in how complex systems get better.
Exactly. This deep dive is really for you. We're going to try and break down the key parts, the practical steps, cut through some of the jargon, and hopefully hit those aha moments.
And we have our expert here with us to help navigate this complex area, someone who's great at pulling together different pieces of information and showing how they connect. Welcome.
Okay, let's dive right in. Fundamentally, what is a continuous improvement ecosystem in a healthcare setting?
Okay, so at its heart, it's a framework. It needs to be structured, but also agile, adaptable, and really participative.
Participating.
Yeah, that collaboration piece is huge because it's all about empowering everyone, and I mean everyone. Doctors, nurses, admin, support staff, you name it.
Empowering them to do what exactly?
To actively take part in making things better. So spotting problems, for starters, then working together, innovating solutions, testing them out rigorously, measuring the results.
And then presumably scaling up what works.
Precisely. Scaling up what works and doing it in a way that lasts, that's sustainable.
So this isn't just like putting out fires as they pop up. It sounds much more systemic. Forward-looking.
That's exactly it. Yeah. A real defining feature is that commitment to always be learning. Honestly, looking at what went well, but also what didn't, and using that to guide what you do next. It really thrives on breaking down those silos between departments, getting real cross-functional teams working together.
And leadership, where do they fit in?
Leadership commitment is critical.
Yeah.
But it can't just be lip service. It has to be visible. You see it in how resources are allocated, who's championing these efforts. You need structured processes for improvement, clear feedback loops so you know what effect changes are having, and a culture that genuinely encourages people to try new things.
Right. So the big shift seems to be moving away from these sort of isolated improvement projects towards building a whole interconnected system.
You've got it. A dynamic system focused purely on betterment.
Okay, that makes sense. So if that's the big picture, what are the absolute essentials, the non-negotiables? What holds this whole ecosystem up? What are these pillars?
Yeah, think of it like building something solid. You need strong supports. The first pillar, I'd say, is leadership and governance. Yeah. And this is more than just getting the executives to nod along. It means deep, visible commitment right from the top. You see it in the budget, and who's leading the charge on quality improvement, or QI.
So defined roles.
Defined QI leadership roles, definitely, and making sure all these improvement efforts line up directly with the hospital's or the organization's main strategy. Key insight here. Real leadership isn't just saying QI is important. It's actively shaping priorities and putting resources behind it.
Yeah, that makes total sense. If the bosses aren't really behind it, it's hard to see how it gets off the ground. Okay, what's pillar number 2?
Next up is the culture of quality. And this is really about the people side of things.
How so?
It's about creating an environment where people feel safe, psychologically safe, safe enough to point out problems or suggest ideas without worrying about, getting blamed or penalized.
That sounds crucial, but maybe difficult to achieve.
It can be, but it's essential. It needs a real openness to feedback, the good and the bad. And fundamentally, it's about shifting towards what's called a just culture.
A just culture.
Yeah, where the focus isn't on blaming individuals when something goes wrong, but on understanding why it went wrong, looking at the system factors. Learning comes first. Punishment is really a last resort, if appropriate at all. Key insight. This culture empowers everyone, seeing mistakes not as failures, but as chances to learn and make the system better.
That term just culture is interesting. Can you unpack that just a little bit more? What's the distinction it's making?
Sure. So a just culture starts by accepting that, look, people make mistakes, human error happens. But it tries to differentiate. Was it an honest slip-up? Was the system set up in a way that made the error likely? Or was it, genuinely reckless behavior?
Ah, I see.
So while the emphasis is massively on learning from errors, to improve the system, it doesn't completely ignore individual accountability when it's clearly warranted, like in cases of negligence. It's about finding that balance, right, between being blame-free for honest errors and having consequences for willful disregard.
That's a really important distinction. Okay, so you have this culture that encourages openness and learning. What kind of practical infrastructure do you need to actually support that?
Well, that leads us perfectly into the third pillar, QI infrastructure. This is the tangible stuff, the support system.
Like what? What does that include?
It includes things like having dedicated QI departments or teams, using visual dashboards so everyone can see progress on key metrics in real time, having digital platforms maybe for easier collaboration between different teams,
Okay.
and having well-defined standard operating procedures, SOPs. But importantly, these SOPs aren't set in stone. They're living documents, constantly being reviewed and improved too. Key insight. Good infrastructure provides the actual tools, resources, and platforms needed to make improvement work happen smoothly across the board.
Right, so it's not just about the right attitude, but also the right tools and processes. Now, what about making sure people actually know how to do this improvement work, the skills?
Yeah, that's pillar number 4, capacity building. This is all about investing in your people, training programs at every level of the organization,
Training in what specifically?
training in recognized QI methods, things like Lean, maybe Six Sigma if it fits, and those PDSA cycles we'll probably talk more about. Practical tools people can use.
So getting everyone speaking the same language in a way.
Exactly. And it's also about growing your own experts internally, identifying people who can be QI champions in their areas, maybe even using a train-the-trainer approach so the knowledge spreads more widely.
Yeah.
Key insight. You need to build that internal QI muscle, making sure everyone understands the core ideas and methods.
Got it. Build the internal capability. Now, healthcare, as we know, just swims in data. How does that critical piece fit into this CI ecosystem?
Oh, data and measurement systems are absolutely fundamental. Pillar 5. This is about putting systems in place like real-time dashboards that give people easy access to up-to-date info on key performance indicators, KPIs.
So moving beyond reports that are weeks old.
Ideally, yes, real-time makes a difference. But it's also about being rigorous in collecting and analyzing the data you have, and crucially, stratifying it.
Stratifying, meaning?
Meaning breaking it down. So don't just look at the overall infection rate. Look at it by hospital unit or by patient demographic or by shift. That helps you spot the patterns and really target your improvement efforts effectively. This data isn't just for looking back. It's the fuel for making smart decisions about what to improve next. Key insight. Solid data systems give you the objective proof you need to find opportunities, see if your changes are working, and make informed choices.
It really feels like for this to stick, you need everyone involved in care to be on board, participating. How do you make that happen? How do you get that wide engagement?
That's the core of Pillar 6, patient and staff engagement. This means actively, genuinely involving patients in designing how their care works and in improvement projects. Their perspective is invaluable.
Right. And the staff.
Equally critical. You need to empower the frontline staff, the nurses, the doctors, the techs, everyone who's actually delivering care day to day. They need to feel empowered not just to flag problems, but also to be part of figuring out and implementing the solutions. Their hands-on insight is often the most valuable. Key insight. Engaging patients and staff creates ownership and ensures improvements are relevant and truly meet the needs of everyone involved.
Makes sense. And I guess finally in today's world, technology must play a pretty big role.
It certainly does. Technology enablement is our final pillar, number 7. This means using digital QI tools strategically.
Can you give some examples?
Sure. Things like AI analytics, maybe, for spotting trends early, like predicting potential readmissions or tracking healthcare-associated infections, HAIs. Integrating QI tools with electronic health records, EHRs, is huge too.
How so?
Well, you could get real-time alerts, for instance, flagging potential medication errors before they happen, supporting clinical decisions right there at the point of care. Key insight. Technology is a powerful helper. It gives you tools and data insights to speed things up. But remember, it supports the human effort. It doesn't replace it.
Okay, that's a really clear breakdown of the pillars. Leadership, culture, infrastructure, capacity building, data, engagement, and technology. Got it. Now, once these are, let's say, being built, how does the improvement actually happen day to day? What are the frameworks, the methods people use?
Right. There are several core frameworks that really guide the work. Probably the most fundamental and widely used is the PDSA cycle.
PDSO.
Plan, Do, Study, Act. It's a really practical, iterative way to test changes. You plan a small test, you do the test, You study the results, observe, analyze, and then you act based on what you learned.
So you might tweak the change or maybe scrap it.
Exactly.
Yeah.
Or maybe you plan the next cycle building on the first. It's like making small adjustments, seeing what happens, and then adjusting again. Very hands-on.
Okay, very practical, adaptable. What else is common?
Lean healthcare is another big one. Very valuable. The core idea in lean is hunting down and eliminating waste. Anything that doesn't add value for the patient.
Waste in healthcare? Like what?
Oh, it can be lots of things. Patients being moved unnecessarily, staff walking miles to find supplies, delays in getting test results, waiting times for appointments.
Unused supplies even.
Absolutely. Unused supplies sitting in cupboards is a classic example of inventory waste. Resources tied up when they could be used for care. Lean helps you see and tackle all that. Think about streamlining how patients are admitted or discharged.
Oh,
Lean principles are often applied there.
you mentioned lean looks at specific categories of waste.
It does, yeah. Traditionally, there are 8. Defects, things that need fixing. Overproduction, doing more than needed. Waiting, just delays. Non-utilized talent, not using people's skills fully. Transportation, moving stuff unnecessarily. Inventory, having too much supply. Motion, people moving unnecessarily. And extra processing, doing steps that aren't really required.
That's a really useful lens to look through. Okay, so lean tackles waste and flow. What about methods focused more on, say, consistency or precision?
That's where Six Sigma often comes in. It's very data heavy. The main goal is to reduce variation in processes, make things more predictable, more precise.
Fewer errors, basically.
Fewer errors, more consistency. It uses a specific set of statistical tools to drive towards really high levels of quality.
Okay, lean for waste and flow, Six Sigma for reducing variation. What about just everyday small improvements? Does everyone need to be a Six Sigma black belt?
Huh? No, definitely not.
Yeah.
That's where Kaizen comes in. It's a philosophy, really, about continuous, small, incremental improvements made by everyone, every day.
How does that work in practice?
Well, a great example is from Narayana Health in India. They use daily QI huddles, quick meetings on the wards and the operating theaters.
Just brief check-ins.
Yeah, brief, focused, but they empower the frontline staffs right there to identify small bits of waste or inefficiency they see in their daily work and figure out how to fix them. And those little fixes add up. They saw real results, like getting operating rooms ready faster between cases.
I like that. Small steps, big impact over time. Are there other frameworks focused on empowering specific teams?
Yes, the idea of clinical microsystems is important here. It focuses on those small functional teams that deliver care directly, like a primary care practice team or a specific ward team. The framework empowers that team to own and improve its own specific system of work.
Right.
Because who knows it better?
Makes sense.
And then there's the balanced scorecard for healthcare. This is more strategic. It's a way for the organization to measure performance across different areas, not just the financial bottom line. So looking at patient satisfaction, internal process efficiency, and also, importantly, learning and growth.
So quite a toolbox of methods: PDSA, Lean, Six Sigma, Kaizen, microsystems, balanced scorecard. Okay, we have the what, the ecosystem, and the how these methods. Now let's get really practical. An organization wants to build this. Where do they actually begin? What's step 1?
Okay, step 1 is absolutely establish CI governance. You have to get the leadership structure right from the start.
Meaning
Setting up a dedicated quality council, probably including top leaders from across the organization. This group needs to define clear, measurable goals for improvement. What are we aiming for? Better patient safety, more efficiency, better patient experience, improving equity.
So setting the direction.
Exactly. And critically, this first step also means appointing dedicated QI leads in different departments or units, people who will champion and oversee the work in their areas.
Right. Get the leadership and the goals clear up front. What comes next?
Next, you absolutely have to build QI capacity. You need to equip your people.
The training piece we mentioned.
Yes. Investing strategically in training programs, making sure staff at all levels, clinicians, admin, support, everyone get a basic understanding of QI tools and methods.
Should this be part of onboarding?
Ideally, yes.
Yeah.
Integrate it into onboarding for new hires, build it into continuing medical education, CME, for existing staff, and, as we said, develop those internal QI champions. Maybe use train the trainer models to really spread the knowledge. You need that baseline capability across the organization.
Makes perfect sense. You need people to understand the how. Okay, step 3.
Step 3 is becoming truly data-driven. This means investing in those real-time, user-friendly digital dashboards we talked about, making key data visible and accessible.
And collecting the right data.
Collecting it consistently,
Yeah.
analyzing it rigorously, And remembering to stratify it, break it down to find those specific patterns and target areas effectively. Like looking at falls per unit, not just overall fall.
And linking data to feedback.
Yes, linking quality metrics to performance feedback. Though, as one source noted, maybe not directly tying it to individual pay or appraisals, necessarily. That can sometimes create unintended consequences. But definitely using data to inform performance conversations.
Okay, data as the evidence base. Then what about getting everyone involved, that engagement piece?
Step 4 is all about engaging everyone. Actively cultivate that participation. Simple things work like idea boxes, physical or virtual, for staff suggestions.
What about more structured things?
You could organize events like improvement hackathons to tackle specific problems. Definitely form cross-departmental QI teams, get different perspectives working together. And, crucially, celebrate the wins.
How?
Maybe a quality star of the month or something similar. Public recognition really helps build momentum. And don't forget the patients finding ways to include them on QI boards or having robust ways to gather and act on their feedback. That's vital.
Building that collective ownership. Okay, what's the final step in getting this started?
The last initial step is to test and scale innovations carefully. Don't try to boil the ocean. Start small.
With those PDSA cycles.
Exactly. Use PDSA cycles. Do rapid cycle testing on small pilot projects first. See if the change actually works, if it's feasible, before you try to roll it out everywhere.
Measure the results first.
Measure the results. Use the data. Only scale up what proves to be effective. And even then, keep measuring the impact after you scale it.
Oh.
Look at Virginia Mason Medical Center. Their lean approach led to big drops in errors and falls, but it was built on that cycle of testing and careful scaling.
Right. So it's a very deliberate process. Yeah. Governance, capacity, data, engagement, and then test and scale.
Okay. We've talked a lot about structures, processes, methods, but it really feels like the underlying culture of the organization is make or break here.
Oh, absolutely. You've hit the nail on the head. That crucial culture shift is, well, it's everything. It's the foundation everything else rests on.
And the core of that shift is moving away from blame. Yes, moving away from that old punitive error culture where mistakes mean blame towards that just culture we discussed, where the first question when something goes wrong isn't whose fault is it, but why did it happen?
Focusing on the system.
Focusing on understanding the root causes, identifying the system weaknesses that allowed the error so you can prevent it from happening again. Learning over blaming.
What else is part of that culture shift besides the just culture aspect?
Well, it's also about shifting from just top-down orders to genuinely encouraging and valuing ideas that come from the bottom up.
Yeah.
From the frontline staff.
The people doing the work.
Exactly. Empowering them not just to spot problems, but to be part of the solution. And when errors do happen, focusing on fixing the system or the process that contributed, not just focusing on the individual involved.
And letting go of, we've always done it this way.
Precisely. It's adopting that mindset of, okay, let's test something potentially better, instead of automatically resisting change because it's unfamiliar. That shift is huge.
It sounds like a really profound change for many places. Now, we touched on it, but maybe we can dig a bit deeper into how technology specifically acts as an enabler here. What does that look like in practice?
Sure. Technology offers a lot of support. We're seeing more sophisticated AI dashboards now, analyzing patient data to give early warnings, maybe predicting readmission risks or spotting infection outbreaks sooner.
That sounds powerful.
It can be. Also things like mobile apps for QI, making it super easy for staff right at the bedside to report an incident or a near miss instantly.
Instead of filling out a form later.
Right. And integrating alerts or decision support tools directly into the EHR. Think about an alert for a potential drug interaction popping up right when the doctor's prescribing. That can prevent errors at the point of care.
And for team communication.
Digital QI boards in huddle areas are great for that. Real-time data, visible to the whole team, sparking discussion. And for organizations spread across multiple sites, tele-QI platforms are becoming common virtual meetings, sharing best practices across the system.
So, lots of potential tools. What's the key thing to remember about technology's role?
The absolute key is that technology supports, it enables, but it doesn't drive the improvement. It should always be in service of the people and the process improvement goals.
Right.
It's a tool to enhance human effort, thinking, collaboration, not a replacement for it. The focus has to stay on improving the systems with tech helping out.
Okay, that makes sense. Now, all this effort, building the ecosystem, shifting the culture, using tech, how does an organization actually know if it's working? How do you measure success?
That's critical, obviously. You need good metrics, One big one is clear reductions in errors and infections. You measure that through things like clinical audits, tracking outcomes from root cause analyses, RCAs.
What else? Patient perspective.
Absolutely.
Yeah.
Improved patient satisfaction. You can track that using standard surveys like HCHPS or maybe hospital-specific feedback tools.
And the improvement work itself.
Yeah, you want to measure QI project throughput. How many projects are active? How many getting completed successfully? Are you actually moving improvements forward?
And staff involvement.
Definitely measure frontline engagement.
Right.
What percentage of staff are participating in QI? Are they submitting ideas? That tells you about the health of the culture.
Any financial metrics?
Yes. You should also look for cost savings. Can you demonstrate savings from improved efficiency or reduced waste? That often helps get sustained buy-in.
So a mix of clinical, patient, operational, and financial measures.
Yeah.
Now, even with a good plan and good metrics, it feels like the day-to-day work of implementation and adaptation must be ongoing. It's not one and done.
Not at all. It's absolutely ongoing. And maybe the single biggest factor for success is leadership buy-in at all levels.
Still coming back to leadership.
It's that crucial. You need consistent commitment, visible support, active participation from leaders right across the board. Without that, things tend to fizzle out.
And the continuous part of continuous improvement.
Right. You have to remember, it's a journey, not a destination. It requires this mindset of always being willing to adapt, to refine your processes as you learn what works in your specific context and as healthcare itself changes. I love that quote from Skip Stewart.
What was that?
Our improvement process also has to improve so that next year it's better than it was this year. It perfectly captures that dynamic need for ongoing refinement.
That's a great quote. It really hits home that the improvement system itself needs improving. What else is key for making this stick long term?
Well, making sure you explicitly align CI initiatives with the organization's main strategic goals and mission, that provides focus and shows the impact.
Can you give an example?
Sure. If a top strategic goal is improving patient safety, then a CI project using, say, TWI methods to reduce infections needs to be clearly shown as contributing directly to that big goal.
Got it. Link it clearly.
Also, using recognized formal models for CI like Lean or the IHI model provides structure, and having clear metrics that everyone understands and uses is vital.
And involving everyone.
Yes, actively involving all stakeholders, not just doctors and nurses, but all team members, and critically, patients and their families too. Their input is essential for making it truly effective and patient-centered.
It's interesting how you also mentioned external bodies playing a role.
Yeah, absolutely. There are often national frameworks and support systems that help. Like in India, you have the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
What do?
They set quality benchmarks, run accreditation programs. That external validation can be a powerful driver for improvement.
And private consultants.
Right. There are also private groups, like the Supreme Medic Consultancy mentioned in the sources, that offer expertise to help hospitals develop their quality systems, maybe prepare for accreditation like NABH. So there's support out there.
Okay, so internal effort combined potentially with external guidance and standards. As we kind of pull this all together now, what are the absolute core final takeaways you'd want someone listening to really grasp about continuous improvement in healthcare?
Okay, first big one. CI isn't just a lump of projects. It's a fundamental philosophy. It's about building this living, breathing ecosystem in the organization.
Right.
Second, the core principles are always about empowering your people, aligning everyone towards shared goals, and constantly rigorously measuring the impact of what you're doing.
And technology.
Technology is a great tool, powerful support, but the human element, the culture, the engagement, understanding the systems, that's still paramount.
Okay.
Also, sustainability matters. Continuous learning matters. And focusing on equity has to be part of the conversation for long-term success.
And that quote about systems.
Yes. Let's end with that because it's so true. Every system is perfectly designed to get the results it gets. To change outcomes, we must change the system. That really sums up the core challenge and opportunity of CI.
That's a powerful thought to reflect on. So to summarize our deep dive today, building a continuous improvement ecosystem in healthcare, well, it's clearly a complex journey. It needs real commitment to the culture, the infrastructure, the data, and fundamentally, the people.
It really is about creating a learning organization.
Exactly, where everyone feels they have a role and the tools to make healthcare better, safer, more effective. Hopefully this discussion has given you, our listener, some valuable clarity, a better perspective on the principles and the practical steps involved.
Hope so.
And maybe a final thought to leave you with. As healthcare keeps changing so rapidly, How can we get individual patients and their families even more deeply woven into these CI ecosystems? How do we make sure their voices, their experiences, genuinely shape the future of care?
Hmm, that's a great question to ponder.
Thank you for joining us for this deep dive.